Did you know that more than 1.6 billion people around the world have anemia? According to the World Health Organization report, around 40% of pregnant women and 42% of children under the age of 5 are anemic. What's even worse is that most people who are anemic don't even know they are. They don't know that being anemic can sometimes have dangerous effects. So in this video, we'll let you know about the silent symptoms of anemia you shouldn't ignore. So let's jump right in. Number 1, paleness of the skin. Being the most visible portion of our bodies, our skin frequently communicates with us through signs about how well our bodies are functioning or whether anything is not quite right. Healthy skin has a pinkish hue and a healthy complexion because it receives enough nutrients and oxygen from the blood capillaries that lie beneath the skin. However, if your skin appears dull and lifeless, it may be a sign of anemia, which occurs when the skin cells in your body do not receive enough blood or oxygen. Anemia signs can also appear in the gums, lips, lower eyelids, and nails in addition to the skin. Therefore, you shouldn't ignore anything similar if you've noticed it recently, as it can be a subtle sign of anemia. Number 2, pica syndrome. Iron deficiency of critical severity can induce intense desires for non-nutritional foods, including baking soda and ice. Additionally, certain individuals may develop cravings for substances other than food, including soil, paper, chalk, and pottery. The term for this condition is pica syndrome. There is an increased risk of developing this disorder in conjunction with other symptoms of anemia in children and pregnant women. Therefore, if you experience comparable appetites, you should be aware that they may be anemia's silent symptom, which you should not ignore. Number 3, frequent tiredness and fatigue. If you frequently feel lethargic, drowsy, or exhausted, it may also indicate that your muscles aren't receiving enough oxygen or energy to remain active. The red blood cell's vital component, hemoglobin, is in charge of carrying oxygen throughout your body. Iron deficiency anemia and other related illnesses can cause a critical iron deficit that can seriously impair iron production, leading to a reduction in red blood cells or low oxygen levels in the body. In the end, this may lead to persistent fatigue and exhaustion. Therefore, you should think about the potential that anemia may be the cause of your symptoms if you are experiencing them. Number 4, shortness of breath. Shortness of breath is another complication of anemia or low hemoglobin levels. Lower oxygen levels are more likely to be the consequence of low hemoglobin levels in the blood. The lungs will normally attempt to breathe in oxygen more quickly than usual in order to keep up with the levels that our body needs, which might cause shortness of breath or a faster rate of breathing. Number 5, dizziness and headache. Your brain and other organs receive enough oxygen while you're in good health. Oxygen to the brain may not be available if there is insufficient hemoglobin in the blood. Numerous symptoms, such as headaches and vertigo, may result from this in turn. Furthermore, exceptionally low oxygen levels in the brain might cause serious side effects like seizures, fainting, brain damage, and other neurological conditions. Moreover, very low hemoglobin levels might cause a reduction in blood cells, which can cause low blood pressure and blood thinness. There could potentially be deadly repercussions if this is ignored for too long. Due to the possibility that these are subtle indicators of anemia, it is vitally important to treat them seriously. Number 6, chest pain and irregular heartbeats. There are many reasons why someone might have chest pain or beats, so you should never ignore them. It's possible that not enough oxygen in the blood can make the heart beat fast or palpate, along with chest pain. Blood that doesn't have enough hemoglobin may make you breathe quickly and make your heart beat faster than normal to try to get oxygen to all parts of your body. This makes the heart work much harder, which puts more stress on the heart. That can lead to chest pain, palpitations, and heartbeats that aren't normal in the long run. In its worst forms, this disease may even lead to heart failure and strokes. So, you should never ignore these signs and should see a doctor right away if this happens. Number 7, tingling in hands and feet. It can feel like your hands and feet are tingling if you have anemia, poor blood flow, or not enough oxygen getting to them. It can also make your feet and hands feel cold, even if it's warm outside. A severe lack of iron, like iron deficiency anemia, can also cause cramps in the muscles, restless leg syndrome, weakness, and tiredness, all of which can make it hard to sleep. So, if you have any or all of these symptoms, often for no clear reason, you should know that it might be one of the quiet signs of anemia that you shouldn't ignore. Number 8, frequent infections. A healthy defense system is another important thing that iron does. If you don't get enough of this important element, you may be more likely to get infections and other illnesses. There are 2 ways this could happen. First, it can make the spleen less effective. The spleen is where our body's defense cells, called white blood cells, live. Less white blood cells can happen when the spleen doesn't work right, which makes the immune system weak. Second, our lymph nodes are also hurt by having too little iron in our blood. Lymph nodes are where white blood cells live and get rid of many of the harmful substances in the blood that can cause infections. Too few red blood cells going to lymph nodes will make it more likely for them to get infections. Because of these things, your body is more likely to get sick, which means that getting sick a lot for no clear reason could be a sign of anemia. What should you do if you have anemia? If you have any of these symptoms, then you should see your doctor for a proper diagnosis. Along with your past medical history, your doctor will ask you about your lifestyle. They might run specific tests to find out what could be causing the symptoms if the source of the anemia is unclear. Frequently, the doctors will ask for a full blood count. This will show you whether your red blood cell count is within normal limits or not. The most common type of anemia is undoubtedly iron deficiency anemia. Other kinds, such as vitamin B12 and folate deficiencies, will also be checked for by the blood test. If you have iron deficiency anemia, you ought to think about doing 2 steps. First, you ought to incorporate iron supplements into your regular diet. The second thing you should do is add more foods high in iron to your everyday diet. Green leafy vegetables, red meat, dried fruits, and pulses are foods you should seek out. A few foods should also be avoided at all costs since they may prevent your body from absorbing iron. Brown rice, coffee, tea, milk, and dairy products are a few of these. If you found this video valuable, then make sure to hit the like button and subscribe to the channel for more insightful content like this.